Well, I love what Caroline Leaf has to say. She says, "Your purpose is not that thing that you do, it's the thing that happens in the lives of others when you do what you do." I'm Scott Little. I'm a doctor of chiropractic, blessed and privileged to care for people of all ages and animals of a variety of size and species with our light force adjusting methods. And I'd really like to talk today about the term coherence. Not a very sexy term, not a term that we use in everyday conversation. Perhaps the closest we come is to describe someone's quality of speech. If we can't understand a word they are saying, we say they are incoherent. Coherence, however, has become a word very, very special and dear to me as it relates to communicating chiropractic. Caroline Leaf asks, or rather states, your purpose is not that thing that you do, it's the thing that happens in the lives of others when you do what you do. What happens in the lives of our chiropractic patients when we locate, analyze, and facilitate the correction of vertebral subluxation as it relates to what innate intelligence is able to do in the body? Whether that patient is a newborn infant, an all-star athlete, a senior citizen, a Clydesdale, or a Chihuahua, what happens in the life of that patient when we do what we do? And the answer, I believe, is coherence. We restore coherence. We elevate the level of coherence. We reduce interference to coherence. And so I would humbly suggest that the term coherence is worthy of our exploration. So I first hear the term coherence as it relates to chiropractic when I learned that Dr. Matt McCoy of McCoy Press and Foundation for Vertebral Subluxation, vertebralsubluxationresearch.com, has a publication. He has numerous publications. One of them is really, I think, it's geared for us, but it's also geared for the public, and that is Coherence Through Chiropractic. And in this journal, he may have one edition dedicated to animal chiropractic and infants or pregnancy or the relationship between the vertebral subluxation and an assault on the immune system. He may have something on recovery, rejuvenation, etc., or on stress, mental, emotional, chemical stress, always relating vertebral subluxation to a diminished state of being or a decrease in levels of coherence. So coherence refers to a state of wholeness, harmony, and organized function within and across all systems of the body, mind, and our energy field. Coherence is the hallmark of health, adaptability, and full expression of life, both physically and energetically. It represents alignment between structure and function, form and intention, matter and mind. Coherence is the foundation of organization. When coherence is present, systems communicate clearly, energy flows efficiently, and the innate intelligence of the body is fully expressed. When coherence is disrupted, confusion, interference, dysfunction, and dis-ease may arise across all levels of being, resulting in a diminished state of being, if you will. Well, again, that takes chiropractic in a totally different realm than the guy you go to, the gal you go to when you have a stiff neck or to get your back cracked, or knock on wood, doc, I've never needed my back cracked or my neck popped. Well, I might agree with you there, but that doesn't necessarily mean that your life is in a state of optimal coherence. Here are some synonyms that relate to the term coherence. There's a great number of them. These are either synonyms or terms related: harmony, alignment, integrity, congruence, wholeness, resonance, attunement, flow, unity, connection, organized function, order, resonance, balance, whole host of them. Lots of different synonyms for the term coherence. Certainly I love harmony, wholeness, balance, equilibrium, etc. Well, in our work, we discussed 10 different aspects, and actually I think we've added a couple of them to the list. So there may be 11 or 12 different aspects of coherence. And again, I want you to understand the different aspects and varieties of ways in which we would use the term coherence in our body, because then I just think that, or rather in our profession, I think you'll come to appreciate the term and find ways of using it and how you describe what you do as a chiropractor, what vertebral subluxation does to the patient, and what we can expect to occur after we have facilitated the correction of a vertebral subluxation and allow time and innate intelligence to restore ideal coherence. So there's structural coherence. There's an alignment and balance of the physical frame, obviously, especially the spine, and especially the upper cervical spine, secondarily the sacrum and the pelvis. We talk about tensegrity, this combo term, tension and integrity, a combination of the terms tension and integrity. Sometimes they add the term bio to it, bio-tensegrity, as that relates to our biological and energetic structural, postural integrity. And there's tonal coherence. Chiropractic was founded on tone, so says D.D. Palmer in the title page of his 1910 book. Flipping to page 7, he says, life is the expression of tone. In that sentence is the basic principle of chiropractic, the basic principle of chiropractic. Life is the expression of tone. Well, what is tone? It's rhythmic, vibrational harmony in tissues and systems, tone, oscillation, energy, etc. Well, we're chiropractors. We're concerned with the nervous system, and there's neurological coherence, clear, undistorted transmission of impulses, information from brain cell to tissue cell to brain cell. That's our safety pin cycle. Signals in the nervous system, nerve impulse, mental impulse, etc. There's adaptive coherence. How well does the individual adapt to its external and internal environment? It's a capacity to respond appropriately to change, resilience, and flexibility. There's chemical coherence. Reggie Gold, perhaps and arguably one of the greatest, if not the greatest communicators in a lot of camps of chiropractic and its principles and its nomenclature and ideas, has a wonderful layman's lecture entitled The Chemistry of Life, also known as the letter N talk, but known as the chemistry of life. And he talks about chemical coherence. He doesn't name it that, but he relates the vertebral subluxation to our entire set of body chemistry, which we would refer to as chemical coherence. Internal biochemical balance of your neurotransmitters, your hormones, the fluids in your body, inflammation, all the total of your chemistry working in a state of coherence. Then there's emotional coherence, the ability to process and express emotions fluidly and authentically. Emotions in an appropriate amount of time. It's appropriate to be fearful at the appropriate time. It's appropriate to let that emotion dissipate in a timely manner. It's important to experience sorrow and anger and fear and joy and so emotional coherence would be related to expressing the right emotion for the right amount of time in the right situation. Then there's perceptual coherence, clarity of the sensory and clarity of sensory awareness and inner perception. We talk about intuition. We talk about heart coherence here because this is, we might talk about heart coherence as it relates to visceral coherence and all the organs and glands working together. But the Heart Math Institute might have us looking at heart coherence as it relates to our intuition and a sense of clarity and awareness and our proprioception, our interoception, our neuroception, additional senses that we as chiropractors develop beyond simply the five main senses, perceptual coherence. Then there's biofield coherence. It wasn't too many years ago that the National Institutes of Health, not an organization that we give a lot of honor to, but they coined the term biofield, and it's a scientifically accepted concept that in addition to the matter that makes up our body, there's this energy field that goes out 2 or 3 feet in all directions. And actually, it doesn't start where the skin stops. It goes out 2 or 3 feet, and then it penetrates into every cell in the body. In our work, because chiropractors have often for years talked about the innate field and or the innate energy field, in our work we kind of combine the two and maybe point out differences in the way people think about the biofield, but we call it the innate biofield, and are very open to discussing this energetic exchange of information and connection that can take place between two living organisms, especially doctor, patient, chiropractor, practice member. Then there's spiritual coherence, alignment with your meaning, your purpose, your higher principles. There's social coherence, an authentic connection and relational harmony with others and your environment. I kind of like to combine spiritual coherence and social coherence. One chiropractic guru once shared with me that your spiritual life is that relationship between you and yourself, you and others, you and your creator, you and God. I think that kind of ties in both social and spiritual. And then we might add organic coherence, all of your organs, glands, and systems, the matter of a living thing in active organization. We talk about principles 19 and 21, all of your organs and systems working in a state of coherence. You may be able to come up with dozens of other types of coherence. And how does this relate to chiropractic? Well, we can make the argument that a vertebral subluxation may result in a diminished state of coherence. And we could argue that correcting or facilitating the correction of vertebral subluxation may improve one's level of coherence. And that could be organic, that could be structural or tonal or perceptual or any of these types of adaptive, any of these types of coherence. That's a far cry from the doctor you go to who's a musculoskeletal therapist. As Dr. Christopher Kent wisely points out, even these these chiropractors that consider themselves musculoskeletal therapists or specialists have pain at the core of their objective, and it's awful hard to experience pain without a nervous system. They don't even add neuromusculoskeletal. I don't get it. Well, we study and we argue and we hang our hat on the idea that vertebral subluxation will cause a state of incoherence, and the facilitation of the correction of vertebral subluxation will improve the level of coherence. And that could be, as I said, emotional or spiritual or social or structural or any number of ways in which a person's or an animal's quality of life, health, and vitality is improved. Well, we honor the traditional Palmer-Stevenson definition of a vertebral subluxation. A subluxation is a condition of a vertebra that has lost its proper juxtaposition with the one above, the one below, or both, to an extent less than a luxation, which impinges on nerves and interferes with the transmission of mental impulses. Vertebra that has lost its proper juxtaposition with the one above it, the one below it, or both, less than a luxation, impinges on nerves by occluding a foramen, and interferes with the transmission of mental impulse. Boy, that's a pretty darn good definition. And if that was the only one that we ever studied, we'd be doing pretty well. And there's a big push or a big criticism amongst some that we don't need a definition beyond that. You might be right. I, for one, really like the definition that the Australian Spinal Research Foundation came up with, and I use this a lot. Vertebral subluxation is a diminished state of being comprising a state of reduced coherence, altered biomechanical function, altered neurological function, and altered adaptability. And I have this light bulb on a dimmer switch in my office, and when we talk about a diminished state of being comprising a reduced state of coherence, I might communicate that this is the ideal state of being, this is complete coherence, and subluxation results in a diminished state of being, a reduced state of coherence, and biomechanical function, neurological function, and a reduction in adaptability. There's one other definition that's highly controversial because D.D. Palmer never used it, B.J. Palmer never used it, Stevenson never used it. I first heard John DeMartini use the definition of subluxation as being a condition of less light 30-some years ago. And again, while some really poo-poo the idea, when one studies chiropractic and some of its energetic properties and some quantum type things, and we throw biophotons and photons into the conversation, and we talk about mental impulse and things beyond just nerve impulse and so forth, we start talking about light. And subluxation is a condition of less light. There's no arguing it. So whether you adhere to that definition or not, if we had given Mrs. Stokesbury, my 10th and 11th grade Latin and etymology teacher, she was about 4'9", born about the same year as D.D. Palmer, chain smoked like nobody's business. If you'd have just said to her, Mrs. Stokesbury, what's a subluxation? She would have said, sub is less than, shun is a condition of, lux is light, so a subluxation is a condition of less light. And it really fits with some of our energetic tonal application of chiropractic. And we do study photons and biophotons and the body's energetic system and how that is affected by the structural system and blah, 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 blah. So I like those three definitions, and those three definitions fit very well with what results when we lose coherence and when we facilitate the correction of vertebral subluxation, what might happen as coherence is restored. So vertebral subluxation is not merely a structural issue, it's a coherence issue. Subluxation causes incoherence, and correction or facilitation thereof restores coherence. So whether our patient in question is a human or an animal, subluxation, especially at key areas like the upper cervical area, secondarily the sacrum and pelvis, thirdly perhaps elsewhere, may disrupt any or all of those 10, 11, 12 aspects of coherence that we discussed above. And that certainly makes chiropractic a much bigger thing than the doctor that you go to who's a musculoskeletal therapist, who you go to if you have a bad back or a bad neck to crack your back or pop your neck. As coherence diminishes, the individual may experience interference in their structure, their tone, their neurology, their ability to adapt, their emotions, their ability to perceive, energetic symmetry, field expression, social connection, spiritual alignment, and all of the organs, glands, and systems functioning in a diminished way. This interference may manifest as disharmony, disorganization, disconnection, dysfunction, or dis-ease, even if it's not easily measured, even if we can't analyze the symptoms, or there may not be any symptoms, especially in my animal patients and some folks, infant and pediatric patients. Some of our technologies are not as applicable, but subluxation still results in disharmony, disorganization, disconnection, dysfunction, dis-ease. It's not always easy to do a pre-check and a demonstrative post-check, but boy, is it important. And when appropriate and when possible, it certainly is important to have an appropriate pre- and post-check. Well, what indeed is the role of coherence in chiropractic? Coherence-centered chiropractic is not a new division of chiropractic. We don't need another form of chiropractic. Pediatric chiropractic, we have that. Sports chiropractic, we have that. Pregnancy chiropractic, we have that. Subluxation-based, we have that. Tonal, structural, postural, neurologically based. We have all these different divisions of chiropractic, and I believe the term coherence fits every single one of them. And if your professional objective is one of locating, analyzing, and facilitating the correction of vertebral subluxation by innate intelligence through gentle, precise, scientific application of force or energy, a chiropractor facilitates this process that allows innate intelligence to reorganize and express more fully. Our task is to adapt our procedure, our analysis, and our application of force so that it's appropriate for an all-star quarterback, a pregnant woman, a day-old infant, a Chihuahua, a Clydesdale, etc. Chiropractic is the same, and subluxation results in a lack of coherence in any individual, and facilitation of the correction thereof improves the quality of life, health and vitality, function, adaptability, etc., in any individual. So coherence fits everything. When coherence is restored, life expresses more freely. This may appear as improved structure, tone, behavior, vitality, adaptability, or even emotional state. The specific outcomes are guided by the innate intelligence of the individual, not imposed by me from the outside. I have my preconceived desire because it'll help me build my practice and make me look like an all-star in the eyes of those watching. and expecting something from the adjustment, but it's not for me to determine what innate intelligence does. Coherence is the goal. Vertebral subluxation represents a major interference, and what we do is to try to support a return to wholeness. Your purpose is not that thing you do. It's the thing that happens in the lives of others when you do what you do. Coherence.